Hi everyone, and welcome to our Epworth Graduate Program live Q&A. Thanks so much for joining us. My name's Louisa, and tonight I'm joined by Mark, Karinda and Kim. Thanks so much for joining us tonight. We really appreciate it.
Thanks for having us.
And we're going to be chatting about what it means to be an Epworth nurse or midwife. If you have any questions for our panel, feel free to pop them in a comment on Facebook and we'll get back to them during the stream or as soon as possible afterwards. So I guess we'll just kick off by getting you each to introduce yourself and tell us a bit about your connection to Epworth. So Kim, maybe I'll start with you.
Lovely. Hi, I'm Kim Miles. So I am the Education Manager / Graduate Nurse Coordinator for our Epworth Rehabilitation and Mental Health Division. So looking across all of our 4 sites where we have our graduate nurses and all things education in that space. So I'm involved in that recruitment process of grads coming on to our in the future.
Thank you. Karinda?
Okay, so hi, how you going? My name's Karinda and I've been with Epworth for about 14 years and currently I'm the graduate partial coordinator and undergraduate coordinator as well, clinical facilitator. So just basically there's 3 of us in our role in maternity and we all work together really well. We look after all the postgrads, the undergrads that come through from university, graduates that come through, the work experience girls because we get lots of those as well. And just looking after the support for the staff as well and educational pieces for those for their CPD.
Great.
And my name is Mark. I'm a graduate registered nurse. I've only been here for 3 months. I was a Epworth Fellowship Seed student though last year in my final year of uni. So that's my journey.
Great. So Kim, I might get you to give us a bit of an overview of the Epworth graduate program. Any sort of specialties that you can apply for through that. And maybe a bit about the application process.
Absolutely. So we're very, very lucky that I'm actually representing all of the graduate nurse programs that we do and midwife programs that we do offer across Epworth. So we do have sort of 5 programs run out of our divisions. So one being the rehab and mental health program that I'm largely involved with, plus then the Richmond program where we are tonight here coming from, and also out at Easton where Mark is, and then at Freemasons, and then also down at Geelong as well. So with those programs, they're 12-month programs that we do in most areas except sort of being maternity with mid being something that's a little bit different. They are sort of the 2 rotations that we do across different specialty areas in that time. And largely our programs are very similar in the way they are. Each graduate has the opportunity to attend 5 development days across the year where we do a number of different activities where we do some simulation, we do some discussions, some case studies, some special speakers come in as well on specialist areas to actually talk to the graduates and have those development days. Plus across all our, which Mark has experienced now as well, is that orientation program that we do starting off. So we really want to onboard our new staff, but especially our graduates that are fresh in their career at that point, so have an extensive orientation process and a supernumerary time as well to really give them that support and tailor to their individualised needs as well. So we do have a couple of programs that are of difference. So a lot of those 5 programs are into our ward specialty kind of areas, but we also do have a 12-month perioperative program that comes from Richmond here as well that can be applied for, and also we do have a 12-month mental health program, a straight mental health program as well, where that's actually affiliated with the Epworth Hospital to actually do some study time across there, and which gives credit to sort of a postgraduate certificate at the end of it as well. So we do have a number of those. Most of our specialty areas we do have graduates go into with that, because we really feel like that's a good place for them to start and get support and then sort of recruit into those areas to really develop staff up into those areas. So and graduates do get the chance to actually put down some preferences about where they might want to go to, and most of the time that actually works out that they do get their first or second preference really out of those 2 rotations, which is actually which is great. So that's of particular interest to those as well. Recruitment wise, was that next bit?
In terms of applying, what's the process for that, and when does that all start?
Yeah, so we are all aligned with the computer match process, except for Geelong. So Geelong will actually separately put up their advertisement to apply directly to them for that, and not in the computer match process. But all of the other sites that I did mention, the divisions, will actually go through computer match. So you actually have to register your preferences and then apply online via our website when that goes up it's in the same time in June then to July. That corresponds with that computer match opening time as well. So that's the important thing to remember with that is that if you are applying to each of our sites, then that is a preference in the computer match system as well. So you could have 4 Epworth programs that you're applying for in that. So that would be, that's the process there with recruitment.
Great, and I guess you've sort of touched on it a bit here, but why choose Epworth? Why would Epworth be your preference?
Yeah.
Epworth, to me, look, I've been with Epworth since 2005, and it's like one big, for me, I know it sounds cheesy, but it's like one big happy family. Also, I've got 3 children. I had 2 of my children at the Freemasons. So for me, it really is like a family environment. People have seen my family grow and develop, and they've seen me grow as a midwife as well, which has been great. They're all really inclusive. The program that we've got running is it's pretty good. Like, they've got rotations between birth suite and postnatal and special care nursery, but I won't speak just to maternity, obviously. From what I've heard from other people, Epworth is just a really friendly place to be, and very supportive. I'm sure, Mark, do you have anything else to add to that?
Yeah, I sort of twiddled down my preferences and ended up choosing Epworth mainly based on the support. I felt as though there are a lot of large hospitals out there, but Epworth was probably one of the only large hospitals where they offered a really inclusive supernumerary program plus orientation. I think it went for a combined total of 2 weeks. So the first week was purely orientation. Second week was supernumerary. So I thought if I want to go somewhere in the future, I got to feel supported in the beginning, and I don't want to go to a random hospital and just end up being a dud nurse in my first year. So I sort of wanted that support and that push. And I think it helps because within the first month or 2, I felt really comfortable on the ward, just because, I know it is cheesy, but there literally is just so much support. Like, I don't think there's been 2 or 3 days that have gone by without an education manager stopping by. I'm sure Kim visits all of her grads all the time, but it just, it feels good. It feels like a warm group hug all the time.
Yeah.
So it feels good.
That's nice to hear.
Yeah, it is.
We strive all the time.
And Mark, could you tell us a bit about a day in the life as an Epworth grad?
I find it a really interesting question because I guess the only time I really do feel like a grad is when we go to study days. And as Kim mentioned before, there are 5 study days throughout the year, but I don't really feel like a grad on the wards, because after the first month of not knowing what you're doing or not knowing how to fill out this form or that form and asking all these questions, you sort of get into the groove of things, and then your name is just another employee on the board. And that to me it just feels better, because you don't feel like that odd one out anymore. So I don't really feel as though I'm a grad. I just feel like a registered nurse who happens to be doing their grad year. So it that's just a normal day for me. Just go to work, clock on, do my job, and give good care, I hope.
That's a great answer. Love it. So in terms of skills, what skills do you develop as a grad?
Time management, I think, is a big one.
Yeah, I think time management, especially coming straight out of university. So I've worked many jobs before, but there's no such thing as time management at other jobs compared to nursing, as in they're sort of completely different things.
Yeah.
Because time management during nursing is getting all your paperwork and all of that done, but also dealing with the stuff that's constantly ongoing. Time management, I felt like over the last 2 months has dramatically improved. Nothing that I could have done in my nursing school. So I felt like on placement, it's a bit hard to get a gauge for things because you're sort of restricted at the stuff you want to do. Plus all the things you learn in uni. We get so stressed about it at uni, and it's just one little skill when you're on the job. And within the first month, I reckon I did every single skill that I learnt at uni, and now they're just normal things. They're just day-to-day things, and you learn new things. I mean, I'm on a general medical ward, but we also have surgical patients, so I'm learning a whole heap of things: how to remove drain tubes, how to put in nasogastric tube, how to do this, how to do that. So I could go on and on about skills, but I mean, it could be different for a maternity.
No. I think you've knocked it on the head. Personally, prioritization's probably another good one that comes into hand with that. What else do the grads often say that they learn? People skills, I think, come with the job too, and communication and learning to deal with different families and what's going on for them. And being involved from a maternity perspective, being involved with the greater family, so grandparents, uncles, aunties, little siblings. It's beautiful to see that come together, and for those people to go home and feel like they are part of our family as well. And the grads love that. They often get chocolates. We get lots of chocolates in maternity. And, lots of thank you cards too, which just really makes you feel appreciated. They're probably the big ones for me.
Yeah, and I think that element of teamwork as well. I think that really being part of a team and not thinking that as a grad you have to know everything too at that point. So it's actually engaging with others to be constantly learning and learning more, and delegating sort of tasks with that prioritisation to actually sitting there and not having to think I've just got to do everything myself to prove myself as a grad. The best thing you can ever do is actually go, hang on, I need some help now just to make sure that patient there is happy and comfortable. So can you do that while I'm making this other patient comfortable? Not feeling like you have to do it all yourself. So I think that's something that's just because healthcare nursing is not something we can do. What one person can do is that you rely on your team around so much. Yeah,
absolutely. And it's a 24-hour job too.
That's right.
Yeah.
So I think all three of you have touched on this quite a bit, but where do you turn for support when you need it?
Personally, I turn, in the first few weeks, I would turn straight to my education manager, Suzanne. But as the weeks go on, you feel a lot more supported by the staff on your ward. So not that they weren't supportive in the first place, you're a very nervous wreck. You just don't want to keep on annoying them. But now I feel like the nearest person to me, I'll just ask random questions, like, do I give this medication? What does this say? I can't understand this doctor's writing. Just stuff like that. And then I feel like the next step, I have touched base with my educators a lot. So Suzanne, Jane Thomas at our hospital, Jackie Cook, I feel like I'm always leaning on them. But you've also got your ward educators. So on my ward, I've got Jo, who's there once a week, twice a week, and I'm always touching base with her. So I know personally I I have trouble reading ECGs and all this cardiac stuff, and Joe's been great with all of that, so patient as well. So I think all of the support is there. It's just people need to not be shy and learn how to utilise it, and that's it, because I haven't felt there's ever been a gap in the support, whether that's from NUMs, ANUMs, educators, just registered nurses, enrolled nurses. I just lean on everyone, to be honest.
Actually, I agree with what you said, Mark, that from our grads' perspective, initially they do come to the education team for that support, and then once they find out who they can go to, who they can turn to for advice and support, I find they often approach the NUMs and ANUMs, and even just, people that have been in the grad year just before, like the year before, they're often a really close point for them to touch base because they've been in their shoes just the most recently, so they can relate to what they're going through. So yeah, there's plenty of support around, isn't there? Yeah.
Absolutely.
Exactly.
Yeah.
And I think, and we do have sort of different models across too, with sort of having preceptors, mentors, clinical coaches that actually, some of our wards will have like a couple of preceptors that will kind of be allocated to a grad to kind of give them that on the ward support, because exactly it's 24 hours a day, 7 days a week, and the educator, manager, grad coordinator is not necessarily there at each of those moments. Exactly. We do get to go home every now and then. So it's making sure that we've got those things in place to kind of be able to give you that support in that way. That so many, we've been doing this graduate program for a number of years now with Epworth, that they had before even I was here. So the hospital and the wards and the departments are so used to having graduates there and seeing that it is part of our developing workforce. So we want to support them so that they have good outcomes, and it's good about the team. It's great about the team, but it's also for our graduates to kind of go, well, if you work hard this year as well, we want to keep you on too. And we do have really strong retention rates as well, with our grads wanting to stay on with us, and us keeping them too. So because it's setting up for the future.
Great. I might just jump quickly to a couple of questions we've got that have come through from Facebook. So does Epworth also offer grad programs for enrolled nurses?
Yes, we do. Yes, we do actually. Not across all of our divisions, but most really we do. And we're actually just in the next couple of weeks is our advertisement's going to go up for a mid-year intake of our enrolled nurses in at Geelong Rehab and Mental Health, and also here at Richmond as well. We'll be putting up that to actually look at a mid-year graduate program, and we do have February, March intakes as well every year across Freemasons and Eastern as well. Have I missed anybody? No. Yes.
I think so.
Exactly. Keep me in check. So yes, we do have enrolled nurses come along.
Great.
Yeah.
And someone's asked, what if I don't get my registration in until after June because I'm finishing at the end of June?
So that is for somebody mid-year, obviously starting now actually.
Yeah.
That is a little bit problematic, I would have to say. We do know that occurs, and our intake is actually starting on the 15th of July, so we do know that some people will be finishing. This does get highlighted through APRA, that it's often that point from the university's point of view or the training organisation's point of view to actually do all of their paperwork from that end, that then actually goes through to APRA. So there should be that process that's in place, because a lot of people are coming up to finishing in that time that we are aware of, and that should be able to get through by a starting time there.
I'm just going to squeeze in.
Yeah.
I actually think, correct me if I'm wrong, but I believe that you can apply 6 weeks for your registration before you finish your degree.
That's right.
So I finished my degree last year in October, whatever it was, and I think I applied in early September, and within a month I had my registration. So if that it should take the burden off a lot of people thinking that they won't get in before July, because basically registrations would probably start within the next couple of weeks if you're finishing up in June. So
that's right, because you can get that process started earlier, so that it's just relying on that last minute sort of academic transcript paperwork to come through from the uni side of it to actually go, yep, you're good to go. That's right. So they should be encouraging you to actually get into that registration program process.
Okay, so does anyone have any memorable Epworth stories or experiences they'd like to share?
I have a memorable, it sort of ties back into a question we had before about support. So on my second day, I just had an incident at work where I didn't cope too well. But what I found was that it was just, it sort of stuck with me at how overwhelming the support was. I sort of felt just literally everyone was just around me. Within, I think after the incident happened, I think within 10 minutes I was sitting inside my nurse unit manager's office, and I had multiple ANUMs. I had a NUM, I had both my educators, the education manager, the educator on the ward, I had the hospital coordinator, I had one of the executives come and just check up and see if I was okay. So I think day to day there are so many memorable experiences, just seeing patients get better, or just getting compliments here and there of how great your care is. But this is sort of one of the things that really stuck out to me, because I don't think I'll ever forget the incident and the support that followed immediately after. So if anyone has anything else.
I'm just trying to think, actually. You might go, you can go,
I mean, for me, you know, I've been here at Epworth, starting off with sort of an educator space first and then going into this role. So over that time, and rehabilitation was very new to me at the time as well, and that's been a real learning curve, and memorable for me is in the way of the patient outcomes that we see. We have a number of patients that are in our wards, in our departments, that are there in some instances for a very long period of time, that have come in with quite significant injuries and disabilities, that we've been able to manage them to actually successfully go home and into the community and actually be able to function, where when they first came into us, we think, is there going to be a positive out of this? So it's often, you know, some patients we've had beyond a year with us, and then they'll come back for their outpatient. There's been a couple of people that I've thought about when you ask that question, and it's kind of that they've come for their outpatient appointments and for their therapy after they've been discharged from us, and it's almost like, who's that? Like, you kind of do a double take going, is that really them? Is that them? And just seeing those outcomes, I think of exactly what you said before about those patient outcomes of just making that difference every day, and the families that thank you for that too, of that, when in some ways we take it for granted, I think sometimes, because it is every day and it's what we do, but I feel that it's when you have to reflect on it, you go, wow, we do some really good stuff here. So yeah.
I'll touch on what Kim said, just based in maternity. What we often find is patients will go home with their babies, and they'll come back for their 6-week check with their paediatrician and their obstetrician, and they'll come up to the floor and they'll come and see us, and they'll look specifically for the midwife that was looking after them in birth suite and in postnatal, and especially those ones from special care nursery, those tiny little bubbies that have been there for months and months and months just growing prems, and they've gone in there and they've visited. That's always been a really humbling point for me, seeing that and seeing other people get praise and thanks. Even after 6 weeks, they still remember, these women still, you know, take away such an important part, such an important memory for them, really. So that's really lovely for us to see.
So Mark, you are 3 months in. What are your future goals after you finish up the grad program?
So I used to think long and hard about this before I got a job, once I started nursing, first year, second year of nursing school. And then I remember something stuck with me in one of my interviews with Epworth Richmond, actually. And it was a nurse unit manager that said to me, it's good to have short, medium and long-term goals, but it's such an ever-changing industry that don't get tied down on one exact future goal. But in spite of that, I think one of my main goals is to end up in emergency, sort of in ED, and I really do enjoy all the floor nursing at the moment, but I feel like in 10 years time or 15 years time, once all that adrenaline's out, I really want to move into sort of a management role to try and influence other nurses as well. Not exactly sure what I would do in the future other than sort of those are two main goals, but I know there's so many other things. I just want to upskill. I think as a manager you have a lot of influence as well over the ward, so that'd be a great long-term goal. For the rest of the year, I don't want to make any big mistakes. So I think that's a good short-term goal at the moment. And I think mid-term goal, I hope this helps as well. I'd love to see more males out there as well.
Exactly.
Too many stereotypes going around, so hopefully draws a couple of blokes in as well and just makes it an all-inclusive environment. That'd be good.
Great. And Karinda, I hear you were once an Epworth grad.
Yes.
So could you tell us a bit about your journey from then to now?
So I was an Epworth grad in 2005, and my first rotation was in birth suite. I'll never forget it. And then came out to postnatal, did some special care nursery as well. Actually fell pregnant in my grad year, which I won't forget either. And then look, since then I've done lots of different things in my career to date. I've been in education previous to my current role now as a clinical facilitator. I went back out into management on the floor in postnatal, where I worked. I did night duty permanent for 5 years, and then I went into an ANUM role, and then I went into an acting nurse unit manager role. So I've done a little bit, and then I've come back into education again. I've also gone out and done some university teaching as well, which I've enjoyed. So I think clearly for me, the common thread for me was education. That was my passion, still is my passion. I've loved all the experiences that I've had, and nursing and midwifery are just so diverse. And I think that's what they often forget when they're in the job. Sometimes they might think, come out nice and shiny and new, and they get into a role and they go, well, what next? But there's just so much to do within the nursing and midwifery as well. So I've loved every single part of my career, and being part with Epworth for this whole entire time, I felt really privileged.
And I guess we'll finish off with, do you have any advice for future grads?
There's a few things. You sort of, as you said before, you come in and you're shiny, brand new, and you want to impress everyone. But I sort of think one of the main things I've tried to do this year is self-reflect. So every week I'm learning something new. So just go home after your shift at the end of the week, after 2 weeks, just debrief with yourself. Say, I did this well, this shift felt really good. And not everyone's going to have a good run of shifts every single day. You will have a bad shift, and you will have a average feeling shift, and then you'll go home one day feeling on top of the world. So I think it's good to self-reflect and put everything into perspective. You are a grad. I'm only 3 months in, so every time you sort of think, I really know what I'm doing here, I give myself a pat on the back, but then I'm humbled when I go home and I get a phone call saying, Mark, did you sign off this medication, or something very simple. So I just try to do the basics right, and then everything sort of flows on after that, because you learn to multitask. So at the beginning I would give a patient a medication and I completely forget they're a person, and I just wouldn't talk to them because I was so focused on that skill. So I felt as the first few weeks went on, I just focused so much on the basic skills that everything else just came naturally. So I wasn't trying to jump in all at once. I wasn't trying to be the top nurse. I didn't want to just try and impress everyone. I just thought if I do my job right, then the people skills, the personal experiences, the compliments, everything else will come. And take your time and ask questions. Those are probably the two things that I do a lot. So I do take my time with a lot of things. So medications, I'll always double check. Notes, I'll always make sure I'm writing everything right down, because even though it is something that we do every day, you sort of forget sometimes that it is a legal document. So you've just got to take your time, just relax, just go back to basics, and it usually turns out well. And have fun. Just don't be too hard on yourself. So I'm not afraid to make jokes with the nums, the A nums as well, and even the doctors. I don't see a point of going to work and just trying to impress everyone, but going home and realising you've had no fun at all because you haven't been yourself. So I know I'm never too far away from another joke or a really bad dad joke or something like that. So I will say it, and I'm not afraid to say it, and I'll have fun with the patients as well. And you know which patients you get comfortable with. There'll always be the challenging ones, but no matter what, you just don't take things personally and just do what you have to do. And that's it.
Exactly. I think that is really good advice, like, you know, looking at and taking up those learning opportunities as well. And I think if you get the basics right, you're right, everything else will come after it. And it is about and looking at every opportunity as a learning opportunity as a grad, but then beyond that as well, because you know, certainly me 20 something years down the track now, is every day you're learning something different of what you're doing, and it's to be open to that, because that makes you a better nurse, better person too, doesn't it? But and that's what people value, and that's who they want to work with, and all of those sort of things as well. So I think that's a really you know, good point. And if you know, you mightn't be sort of in an environment where you thought you were going to work in as well, but it's making the most of that and the opportunity that it puts forward for you. Because certainly for me as a grad many moons ago, I was very interested in wanting to I was hanging out to just go on my peri-op rotation and get into theatre and all of that sort of thing. And then I got into that environment, and it was just not what I wanted as a nurse. It wasn't for me. So I was kind of like, oh, well, what do I do now? But the opportunities that opens up, I never would have thought I'd be here now, or doing education in the future as well. So it is about, there's so many things that you can do with nursing that you can just be open to, and go for it as well. So,
and it's really easy to get caught up in the daily grind of your job and not feeling like you've done enough for your patient, or you know, for your colleagues through the day. So I think just remembering all the good things that you've done and taking home. So if you get a card written to you by a patient, keep it in your little feel-good box. I used to have this box called a feel-good box, and I used to put all my compliments in there. So when I was, and I know it sounds cheesy again, but when I was having a really bad day at home and I felt down, I'd go in it and I'd go, actually, I did this. You just remember all your little achievements that you've made, and it makes you feel really good about yourself. You know, I just think everything's just so fast-paced these days, so it's hard to remember those times. So
and that reflection piece as well is something we really are very, I can't think of the word, actually it's gone, but it's something that we are really wanting to do in all of our environments, is actually that our, you know, one-on-one debriefs that we'll have with you, but then also have the group graduate debriefs, so you can actually hear that other people are going, oh, that wasn't so good today, or they've got to be able to do that, and you're like, oh, I want to do that too. So that real shared information across those areas as well, because that's what it is. The best thing you can do is reflect upon, to go, did I do that well today? Or yes, I did all right, but actually I could do that better next time, and do that in half the time next time actually as well. Is often after the first time you do things that take you half an hour, that'll take you 15 the next time you do it, don't they? So,
absolutely.
For sure.
All right. Well, thanks so much for your time tonight. And thanks to everyone for joining us online. We hope to see you at one of our open days coming up soon. There's more details on our careers website. See you later.
Bye. Thank you.
Cheers.